Minista wa Kinandu Mbadi Niwavuthiisya Ateti Ulei ala Methiitwe Maivaka Ndaka Walan'yo Mweu wa Uiiti wa Sha Vala Walumiliilya Sha Ooyu Nzeo na Nithukumite Mamilioni ma Enenthi Ooyu Makeaniwa Mbadi Niwakan'ya Enenthi ala Maendee Kuiya Maiweta kana Sha Iyiuthukuma Kumanwa Ndivi Yiulu Ivindani ya Kwiyiandikithya Vala Walumiliilya kana silikali va ivinda na imwe ikanengane Uiiti wa mana kwa Enenthi. Benjamin Mwaka nukutweleza.
Vikite mbonza maimwana ya mbunge ya kuthima wandikithyo meuma meao Mbadi ni watetea Walan'yo Mweu wa Uiiti wa Sha Vala weta silikali irisa kusioka na itina dhino wa kuthukumithya Walan'yo Mweu wa Uiiti.
Sha is working and Kenyans appreciate it. Where the government is facing serious challenge, and we expected, is this financing of primary health care and financing of emergency chronic and critical illnesses. Those two are supposed to be funded wholly by the government, because SHIF is insurance. Now, these two, we have since enhanced allocation.
Mbadi vikite mbewanza mai kutetea vata wa ilovia mbiange kuvadhiwa ni mbunge kuikithya athukumi silikali mevyani Kukan'Ya ni makwa watoto ni wa kufikia Walan'yo angi maki mbene ma Uiiti. Meuweta irisilia Ateti anakana Sha Iyiuthukuma ni ivitene vinda.
You know, we have something called legitimate expectation. In the letters of appointment of public servants, is this conferred as a benefit so that they expect this medical scheme to be in place?
The purpose of the fund, as indicated here, is to finance the provision of a medical scheme for public officers. Would this be kind of an admission that Sha is not really able to provide health cover properly? That is why, state officers and public officers require an alternative, so that the general public can know, even as they register with Sha, they can also look for private insurance to safeguard themselves.
Sha is working. In fact, let me start from that premise. Those who are in doubt that Sha was not working, I think they have since gone mute. In fact, I wonder whether Honorable Mbadi, by his statement, is still in the school of thought that Sha is not working. For this new program of universal health cover to work, we must finance the primary health care. That is where majority of Kenyans are affected.
Ingi kwenana na Mbadi ni kana Enenthi ni maile kwiyumisya na kuiva Sha mami na Kwiyiandikithya no kana kuvikia Uiiti wina withianu. Maiweta vaitonekana silikali kunengana Uiiti utena Ndivi ona imwe kula kwi Enenthi.
I would be lying to say that all Kenyans will get the same medical cover. It is not possible. That is why we are saying some are getting enhanced medical cover.
So what he has said is that for you to get it sorted out, you have to enhance. Get an insurance company or something. Otherwise, what you'll be getting is just a basic, which is okay. And now Kenyans know.
Chair, I don't want Honorable Mbadi to get away with this. You see, previously, even if you were sick and the medical bill was even just 20, 30, 40, 50,000, you were calling for a rambe. Now that is being minimized to only exceptional cases by this medical cover. And the government is financing it hugely. So it is not something to say that now we know. It is not, Honorable Mbadi, I want to request you to understand the government is doing much more, which probably even the people who are opposing out there don't understand.
Kuma vamusi nilovi delivote ya vilingwa mauvonye nita wa Benjamin Mwaka.